The number of kids in our emergency room has skyrocketed over the last few years. Sometimes almost 50% of the kids in the ED are there for mental health issues, mostly it's suicidality, self-injury.
May is Mental Health Awareness Month, and it arrives as we learn alarming new findings on this issue. A new CDC study finds mental health, particularly among young people, has declined during the pandemic. Researchers collected data from high school students in thousands of schools across the country. Almost half reported feeling consistently sad or hopeless to the point that they stopped doing their usual activities. A particularly sober finding, nearly half of LGBTQ teens said they had seriously considered suicide. Let's bring in psychiatrist Dr. Daniel Bober. Doctor, these are some troubling numbers. What might be driving this?
Well, the decline in mental illness actually predated the pandemic. We were already seeing skyrocketing levels of suicide, depression, anxiety. So this is something that even happened before the pandemic, but was exacerbated by the pandemic. And we're also seeing a record number of pediatric emergency room visits for suspected suicides. So this is something that really is a public health emergency.
What are you seeing and hearing from teens that you treat, that you speak with about these issues?
Well, I think part of the issue is there are a lot of factors that are going on before the pandemic, which has caused teen mental illness to decline. And I think part of that is the fact that obesity is at epidemic levels, and so puberty is happening earlier. Of course, the influence of social media. And a factor that I see that's probably the most important factor is the lack of communication within families. If you look at families who've had teens who've committed suicide, the number one factor in the home is the fact that there's poor communication, that the parents aren't aware of what the kids are doing, who they're with, what activities they're engaging in. So what I say is you have to listen to your teens even when they're not speaking. You have to know what they're involved in, and you have to be present.
So let's talk about that more, being incumbent upon the parents to pick up on these signs of depression. What should parents be looking for when it comes to depression, mental health issues, or just struggles that their child may be going through?
So look for signs of isolation, withdrawal, sleep changes, weight changes, hanging out with a different crowd, letting your hygiene go, keeping secrets, not being involved in activities that usually gave them pleasure before. These are all signs that you need to look out for.
And where do you recommend parents go when they think something's up?
So the first step would be to go to their primary care physician, and that usually serves as the gateway to get help. That person can guide you towards a therapist or a psychiatrist. And then there are resources on the internet, for example, SAMHSA, or the Substance Abuse Mental Health Services Administration at SAMHSA.com are more resources that parents can look for.
Has the pandemic made talking about mental health issues less taboo? Or I'm even thinking of, the high profile, like celebrities coming out and speaking about their mental health struggles. Superstar athletes like Naomi Osaka and Simone Biles, who have been very open about their mental health struggles and have actually taken time off because of it.
I think that certainly helped, but we definitely are still facing the stigma of mental illness. For example, if you go to a party and you tell someone you have diabetes, you're much more likely to get a sympathetic reaction than if you tell them that you have depression. Depression, mental illness is still seen as a weakness and a basic character defect. And until we could get that stigma under control, I think it's going to be an uphill battle.
Well, we are definitely going to do our part to remove that stigma so the people that are struggling can get the help they need. Dr. Daniel Bober, thank you so much for coming on the show and sharing your insight. We appreciate it.
My pleasure.
If you or someone you know is having thoughts of suicide, please call the 24-hour National Suicide Prevention Lifeline. That number, 800-273-8255. You can also text their line at 741-741.